Today, we're diving into a therapy from the cognitive approach, cognitive behavioural therapy, or CBT. This is widely used for treating a range of mental health issues, from anxiety and depression to phobias and more. We'll break down the main aims of CBT and look at its core components: goal setting, dysfunctional thought diaries, cognitive restructuring, and behavioural activation. So, let's get started. First, let's talk about what CBT actually is. Cognitive behavioural therapy is a form of therapy based on the cognitive approach. It's grounded in the idea that our thoughts, feelings, and behaviours are all interconnected. So, if we can change our thoughts, we can influence our feelings and behaviours too. The main aim of CBT is to help people recognise and change unhelpful thinking patterns. The goal is to break cycles of irrational, negative thinking that contribute to emotional distress and problematic behaviour. Rather than focusing on past events, CBT is very practical and focuses on the present, on what's happening now and how to manage it effectively. The first step in CBT is goal setting. Together, the therapist and client work to identify specific goals that the client wants to achieve. These goals can be related to reducing symptoms, learning new skills, or improving overall quality of life. They give the therapy focus and help measure progress over time. Next, we have the dysfunctional thought diary. This is a tool where clients write down their negative thoughts and feelings as they happen. For each situation, they record the thought, how it made them feel, and then they rate the intensity of the feeling and how much they believe in it. By looking back, clients and therapists can identify patterns and recognize which thoughts are consistently unhelpful. Once clients are familiar with their thought patterns, it's time for cognitive restructuring. This is one of the most powerful parts of CBT. Here, clients learn to challenge and reframe their irrational negative thoughts. For example, if someone thinks, "I'm a failure because I didn't pass this test," cognitive restructuring might involve asking, "Is this thought really true?" Or, "Are there other explanations for why I didn't pass?" By challenging these thoughts, clients can replace them with more balanced, realistic ones. The final core component we'll cover is behavioural activation, often introduced through pleasant activity scheduling. This part of CBT encourages clients to engage in activities they enjoy or find fulfilling. It's particularly effective for individuals with depression who may struggle with motivation. The idea is simple: plan at least one pleasant activity each day. These activities can help boost mood, provide a sense of accomplishment, and start a positive cycle of action and reward. So, to summarize, the goals of CBT are to recognize and change unhelpful thoughts and behaviors. This is done through setting achievable goals, using tools like dysfunctional thought diaries, restructuring negative thinking patterns, and incorporating pleasant activities into daily life. By working through these steps, people can develop healthier ways of thinking and coping. Thanks for watching, and don't forget to subscribe for more psychology content. See you next time.